Welcome back to Born for This Stories, where we speak the truths no one told us, so you don't have to carry this alone. Today we are sitting down with Lindsay, a mom whose child was diagnosed with EEC syndrome. It's a rare genetic condition that affects development in ways most parents have never heard of until it becomes their reality. This conversation is about more than a diagnosis. It's about the moment your world shifts. It's about navigating surgeries, specialists, and the unknowns, and still finding your footing as a parent. If you are listening because you just heard a diagnosis that took your breath away, stay with us. You were born for this.
Lindsay, thanks again for being here today. If you could start off just by telling us a little bit about your family and what goes on in your household.
Yeah, my name's Lindsay, and me and my family live in the White Mountains of New Hampshire. And it's family of four, me and my husband, and I have two boys. Denny, he's 14, and Ronan, he is 10. Yeah, we live with our two crazy pets. You could probably hear my dog barking in the back. I tried to put her away, but she's still barking. I have a dog and a cat, sorry. Two crazy pets. We're very outdoorsy, kind of in the perfect area. We used to live over the seacoast, but my husband got a job here at the local hospital. And just kind of chugging along like everybody else.
Yeah, I can imagine. What is it like with a 14 and a 10-year-old boys?
14-year-old is full on into puberty, so that's fun.
Yeah.
But honestly, they are such good kids. I feel so lucky and blessed. They're so kind, and they're smart and just funny, and I don't know. I can't sing their praises.
Oh,
often enough. It's been great. It's been awesome seeing how they develop and who they're becoming, and just finding out who they are.
For sure.
There's a long ways to go, but so this has been interesting, and I feel really lucky because they're good. They're buds.
Yeah, that's amazing.
Knock on wood, we haven't had, fights or anything like that yet. I probably just jinxed myself totally. They're buds and they get along well. So it's been kind of great.
Yeah, I love that. We have two boys. They're 6 and 3 right now. So I'm just prepping for our future.
But they're pretty good at fighting with each other.
Yeah.
Oh, yeah. I mean, it's usually like toys or something like that.
Sure.
Yeah.
100%.
Stage.
We're in the thick of that.
Yeah. Some things do not change.
True.
Well, cool. Well, it sounds like a fun time, and I'm excited to learn all the nuances of that as our kids get older. And let's jump back in. So we have two boys, 14 and 10, and your 10-year-old's name is Ronan?
Ronan, yeah.
Okay. Love that name.
Yeah.
And he's the one that we'll be sharing his story today.
Yes. He's the one who has EEC syndrome, and that it's a mouthful, but that stands for Ectrodactyly Ectodermal Dysplasia Cleft. And I had never heard about it at all before. And so we were living up in Maine, down east Maine. Ellsworth, Clifton, over by Acadia at the time when I got pregnant. And it was when we went for our gender reveal ultrasound that we found out something was off.
Okay.
And so it was kind of crazy. Like, we went in there and the girl was doing the ultrasound, and you could tell. My husband is a doctor, so he could kind of tell from the ultrasound that something was different. Sure. And we're asking. I'm asking. I see she's pausing a lot and not
Mhm.
really saying much. And I'm like, is everything okay? And, of course she can't say anything, but I could tell she's visibly nervous.
Yeah. Yeah.
And so she's like, I need to step out for a second. So she steps out for a bit, and then a doctor comes back in and says, we've noticed some abnormalities, and
Mhm.
we've actually are going to have you, we're going to conference you in on a call with a neonatologist down in Portland, Maine. And we're like, what?
Yeah.
And so just sort of like, deer in headlights kind
Yeah.
of situation. And so we start talking with him, and he's saying, look, I've noticed some things in the ultrasound that I'm pretty sure your child has EEC syndrome. And that he could notice that there was a cleft lip and palate. He noticed that there was some abnormalities in the hands and
Mhm.
feet. And that's where the ectrodactyly part comes in. So EEC
Mhm.
syndrome, if I could give you sort of like a
Yeah.
general kind of thing,
I would love that.
it is a very rare genetic disorder. It's under the big umbrella of ectodermal dysplasia,
Mhm.
which affects hair, skin, nails, teeth, kind of, broadly.
Yeah.
And under that big umbrella are like, I think over 100 like syndromes,
Wow.
subsyndromes,
Wow.
and EEC being one of them, very rare. And his along with a bilateral cleft lip and palate that he's got. His teeth are very malformed.
Mhm.
He's missing a bunch of them. We've had a bunch of them die. Oddly enough, he has all of his bottom teeth, baby teeth,
Yeah.
but there are next to none or next to no adult teeth. So they're just not there. So
Okay.
he's not going to have, like,
Yeah.
he'll maybe have like 3
Yeah.
that we can
Yeah.
see for now, and if they're viable, we'll see.
Sure.
Um, but his skin, he has skin issues, like he gets eczema a lot, like really bad eczema,
Mm.
weeping, bleeding kind of eczema. Let's see. Oh, the ectrodactyly part, that is basically hand and foot, like split malformations. Like,
Mhm.
so he's missing fingers and toes. They're kind of, one hand is kind of clefted, and the other
Yeah.
foot is, oddly enough, his right side is more affected than his left, which
Interesting.
is, I don't know, it's strange. But so he's missing hands and, I'm sorry, not hands. He's missing fingers and toes, and they're clefted. Um, a lot of these ectodermal dysplasia kids have a really hard time with the sweat. They have sweat gland
Yeah.
issues. Like, some can't sweat at all, so they overheat very easily. So that's a big issue, especially in very warm climates
Sure.
and that kind of thing. Any kind of like overactivity. I've noticed with Ronan, even sitting in the car and the sun is beating down on him, like his face, it looks like he has a fever.
Yeah.
You know. Let's see. Oh, eye abnormalities are huge. His tear ducts are not normal. So when he produces tears, like when he cries, it's teary,
Mhm.
but he has like this discharge, which it makes it look like he has conjunctivitis, like, all the time. It's
Time. Oh,
very thick,
wow.
very sticky. And if we don't clean it, he will get eye infections. So his tear ducts will fill up, and it'll be like a bump, and we
Mhm.
have to push them, express them, and this
Yeah.
like mucus comes out.
Yeah.
And so if you don't clean it, you'll get eye infections, but his literal eyelids will glue shut.
Oh my goodness.
And it's very difficult to get it off without like ripping out all of his eyelashes. It's a whole thing that we have to do like every day, a
Yeah.
couple times a day, make sure that his eyes are clean. um, we've noticed that he has some kidney issues, bladder issues, because his right side is affected more. He has actually 2 ureters coming out of his right kidney instead of one.
Wow.
And we've noticed that there's been GI and GU issues
Yeah.
kind of connected, which has created some very big problems for him at times. Um, he's also had ear issues, because this is a lot of the clefting kind of thing.
Sure.
A lot of kids who have cleft have like ear issues, like the bones aren't, you
Yeah.
know,
Yeah.
formed right or whatever. But we had a surprise the other day, not the other day, sorry, a couple of years ago. He had a cholesteatoma, which is like a
Mm-hmm.
cyst inside of his ear,
Mm-hmm.
but it was pretty extensive, and like he couldn't hear at all out of his right ear, and we had to have like sort of like a semi-emergency surgery to remove that. And thankfully, it didn't get to the mastoid bone, because that could have been very, very bad.
Yeah, sure.
But yeah, it's just like the thing with a lot with EEC syndrome, and I'm not entirely sure about all the other syndromes
Mm-hmm.
underneath ectodermal dysplasia, but no two kids express the same
Mm-hmm.
symptoms. So you
Yeah.
could have one kid diagnosed EEC, that has all of his hands, or I'm sorry, has all of his fingers and toes, or doesn't have any teeth at all. And
Yeah.
then this other kid who, like Ronan, has some teeth, but is missing,
Yeah.
fingers or and stuff like that. So it's been challenging as a parent, because it's not black and white,
Sure. Sure.
and so and it's a lot of the doctors don't know. Like, I have to go in and sort of, educate them, like, this is what's going on, this is, you know the
Yeah.
the traits of this kind of syndrome or whatever. Or I'll be like, hey, if it's like a new doctor, I'll be like, hey, he's got this, read up, because we're coming.
Yeah.
you know
Yeah. For sure.
that
Well, I
kind
would
of thing.
imagine there's not like, and correct me if I'm wrong, is there like an EEC specialist? But it sounds like you probably have like a
You almost,
basket of specialists
yeah, you
based
don't,
on
yeah,
how it presents in each child, right? Which
Exactly.
is just, sounds like a lot because you want someone to specialize in said condition of your child. So
would,
you have the
Right.
information.
would Ronan's
Right. And
case be considered on the more extreme side, or is this fairly common in within that, EEC diagnosis? Because it just seems like, man, that sounds so difficult to manage because you have so many different symptoms, or I don't know if you would call it a symptom, but so many different things that you have to keep track of. It's just so much. Is that
Mhm.
common when you're dealing with EEC?
that's kind of a hard question to answer, because
Mhm.
I mean, yeah, like all these, I have talked with a lot of other people that have either their children has this, or they themselves, and everybody's expressing differently. So
Yeah.
I don't know in comparison if it's considered extreme, because some of
Mhm.
these kids, like, there's cornea issues, and some people can go blind after, a while. Or I'm not sure, it feels extreme to me. You know what I
Yeah.
mean?
Yeah.
Yeah.
No,
um
it's
um and it's really hard to say, because we've had surprises come up. We can expect things like the hair, skin, teeth,
Mm.
nails kind of thing, but there have been things that, like the GI and GU issues, that were kind of surprising to us. And I had to dig and do a little bit of research, and see that there may or may not be an actual, like, documentation that this is part of it. But from what I have seen, the trends of the people that I've talked to, that, like, this seems like it's part of it.
Yeah.
So it's hard to say, if
Yeah.
it's extreme or not. But it's just like, because we've had surprises, and I'm like, what else is going to pop up?
Yeah.
right. And
Yeah.
so now that he is 10, are you still have things slowed down, or are you still experiencing like you just never know what you're going to wake up to, or what's that like?
Well, for him, it's going to be a sort of a lifelong kind of thing. There's going to be like maintenance. Like we are actually gearing up for, we've lost count how many procedures slash surgeries that he's done. We think this one's going to be around, it's number 16. This one's a big surgery. And so this is part of like the maintenance of the things that as he grows, we have to adjust things. And it's like everyday things like his eyes and whatnot, that's going to be a continual thing for throughout his whole life. But we have lulls. We definitely have lulls where, where things feel like they're calming down and they're feeling like a little bit more stable. But then in the middle of that, then there's like, boom, that we have a giant cholesteatoma in your ear and we got to take care of this. Otherwise he could die if we don't. So, so it feels hectic.
Yeah. Always waiting for the other shoe to drop, I'm sure.
Yeah. And for like this next surgery that we're doing, it's a palate expansion. So he's had a device in his mouth to slowly, and we've had to turn the key, every day and slowly like spread it so they can graft a bone from his hip and create the scaffolding for him to create bone around it, kind of thing. And this is all in preparation for hopefully him getting implants for his teeth later on in life. So this is a big one. And they're going to do some dental work in there because there's like an impacted adult tooth that's not viable, and they've got to do some splinting kind of stuff. I don't know. I kind of understand it, but
in all the 16-ish procedures, like to understand all of them, like it's a lot. It's a lot on your plate.
Yeah.
For sure.
Yeah.
You just do the best that you can.
Yeah. Try to keep your head above water kind of thing.
Yeah. How does he handle all of this with being, because just thinking like he's 10, so he understands obviously a lot, and he's, I'm sure, been more understanding of some of these procedures as they come along the way, and I'm sure he's a trooper. How's he do it?
He has been so resilient and adaptive. I just feel so grateful that he's like the best patient. He's all the doctor's favorite patient. And it has been hard, especially some of the recovery after the surgeries and stuff, because there's been some incidents where it's been traumatizing for him.
Absolutely.
But and then as he got older and more aware of like the surgeries, he started to get more scared. But honestly, the iPads have helped in that respect.
Listen,
prepping, getting his mind off of it as he's wheeling into the. That's probably one of the good things about those things.
Absolutely.
But I think what we have done from the get-go is we've prepared him. So there's no surprises for him. And like we talk through it, right? We talk about his feelings and how, if he's nervous or scared, and as he's gotten older, he's been able to express that a little bit more, and he's been able to ask us questions about it. And it's been manageable. I feel like the more we talk about it with him and make him feel more comfortable about what to expect, the better the outcome for us. It was when he was in that middle stage of like probably around 4, where he didn't understand. He was more aware of what was going on, but he didn't understand why. That kind of thing. And that was a little bit tough.
That's a tough age range to have to experience some of these big procedures, and they're not going to understand, but it obviously is necessary, and it's so I'm glad that you're able to talk to him now and see that he's able to express himself, and And hopefully, I mean, I'm sure that will continue as you guys navigate this space
Yeah.
and all that. Cool.
Yeah.
I think we kind of skipped over what we talked about a lot is when you received that diagnosis,
Oh yeah.
Mhm.
um, when it was presented to you, how did you guys take that and how was it delivered and was there
Mhm.
anything that you took away from that? Whether a lot of people feel certain ways about how it's delivered by doctors and different things like that. I mean, can you just speak on that experience a little bit?
Yeah. Well, like I said, it was when he was explaining it to us or whatever, it was sort of like a general kind of thing, you know, because we didn't hadn't heard about it before. I like I said, I felt like a deer in headlights. And
Mhm.
at first, when I heard about that, you know, he was going to be have some, he was going to be deformed or whatever. I don't really like that term, but
Yeah.
um, um, and I was so sad. I mean, if I'm honest, I was
Yeah.
so sad because I mean, I cried for I think like 2 or 3 days, just because I didn't know what to do. I felt an intense amount of guilt
Yeah.
because I myself have severe medical issues
Hmm.
as well, and I thought maybe that what if all the big medications that I'm on, I was like, did I do this
Sure.
to my child? You
Sure.
know, like,
Yeah.
you know, I mean, and it wasn't connected.
Yeah.
It was for us, it was a random mutation of the TP63 gene,
Yeah.
you know,
Yeah.
um, but, you know, you have that guilt
Oh yeah.
immediately. You're like, oh my gosh, you know, but,
Hmm.
after 3 days of getting it out,
Hmm.
then we got to work. You know, we started researching, and as far as like the doctors, I mean, I feel I think it was fine.
Hmm.
The he gave us enough information for us to be able to prepare, if
Good,
that
good.
makes
Yeah.
sense,
Yeah.
which was nice. I don't know how much he himself knew about the condition, but it was enough for him to give us a diagnosis, which actually is, I think, extremely rare. We were told that it's possible that he was one of the very first diagnosed in the womb,
Wow.
because it's so rare that most doctors have never heard of it or seen of it. And so when the child comes out, they're like, whoa, what's going
Yeah.
on?
Yeah.
You know,
For sure.
so I felt like I had a good experience with it because for myself, because we were able to prepare.
What did that
Yeah.
preparation look like?
Okay, so well, we started researching, you know, what exactly the syndrome was, and then I don't know, it felt like kismet because when we were researching this, we came across this foundation called the National Foundation for Ectodermal Dysplasia, and it's a support group, a worldwide support group for ectodermal dysplasia. And they actually happened to have they have a conference every year, and it's
Hmm.
different parts of the United States, but it happened to be in New York, which was kind of close to us at the
Yeah.
time. And it was only like a few, maybe like a month or two away, and so we signed up immediately
Yeah.
and went to the conference and got to learn about the syndrome, or
Hmm.
all the different syndromes of ectodermal dysplasia. We got to learn about how to deal with like insurance companies,
Mm.
um,
Wow.
like uh, not providing, you know, coverage for certain procedures and what to do and who to talk to. And that was an incredibly valuable, the whole
Absolutely.
NFED is an incredibly valuable resource. But also, and we got to meet other people that
Yeah.
were experiencing this. But I'm tooting their horn because not only do they do like education and support, but they do research, and they do a camp every year for the children, so
That's
the parents can
amazing.
go to these meetings and meet doctors and talk about things while the kids meet other kids like themselves and have
Yeah.
like such a good time.
Yeah.
It was the most valuable resource that we have found
Oh, I love
for
that.
him.
I love
Yeah,
that.
and it's just that part. So we were able to learn a lot from them and get connected with other people and ask them questions. And yeah, so it was that was kind of our initial process, was just get to work.
Yeah.
You gotta prepare for your kid,
Yeah.
you
What a
know.
great organization too. And I think there is something to be said about surrounding yourself with other, parents and the kids around other kids that are, going through the same thing. So you feel
Yeah,
less isolated. I mean, lots of guests that we talk to, like some of these conditions, obviously like yours and Ronan's is very rare. And
right.
all we have, thank goodness, all we have is online, like
No,
Facebook
yeah,
groups and stuff. Like that is a blessing these
yeah,
days for sure. It can bring community together across like worldwide, but then also
yeah.
there's something to be said about being in person and with other people that fully understand, at least
Hmm.
as close as possible, the walk of life that you're going through or about to go through. And
Absolutely.
so that's great.
Absolutely. I mean, there's this one woman that ended up connecting with, and she's become a really good friend of mine.
Yeah.
I talk with her all the time. I send her
Yeah.
funny memes and stuff. And
Yeah.
it's been great because if something pops up, I'll jot her a quick note and
Yeah.
be like, hey, did you experience this or
Mhm.
whatever? And she'll write back to me, or like quickly.
Yeah.
So it's not like, yeah, so it's been really, I'm very thankful for that.
Yeah. And I would imagine too, with EEC being also like so diverse in what
Mhm.
can happen, the more people that you bring together, then
Yeah.
hopefully another parent or has a kiddo that has gone through something similar and you can have some camaraderie and like just like
Yeah.
shooting like ideas back and forth or like, does this sound like what your doctor did? Like who is your doctor and all the things.
Yeah.
Because I'm sure.
Yeah, definitely. I've been a part of the a EEC Facebook group, and that was one of the um, sources I used to troubleshoot Ronan's genitourinary
Yeah.
issues. Because I was just like, hey, and I always read what people are going through, because whether or not he's going through it, it's something I can kind of just be like, oh, maybe I need to be on the lookout for this
Yeah.
just in case kind
Being
of thing.
diligent.
And
Yeah.
that's been very, very helpful, because like I said, it's not black and white. There's
Hmm.
so much gray area
Sure.
across the spectrum of it. So
Yeah.
yeah.
Oh, love
Mhm.
that for you guys. What
Mhm.
what is Ronan up to? I mean, does he go to like a normal school? I say normal, but like, what is his life
Yeah,
like?
at first, from the get-go, we got him into speech therapy, which was a very this is when he was like a toddler. Speech therapy, which was necessary but amazing, because he could not be understood,
Yeah.
and except for pretty much by me, because I was a stay-at-home mom, so I was with him all the time. So
Mhm.
it was like I knew his language,
Yeah.
we got him into speech therapy. Initially, we were able to get him into like a preschool program that provided that for him as well. um, and we worked on they helped us also work on OT stuff, like
Great.
post surgery,
Yeah.
like that kind of stuff as well. But he's been there are no like mental deficiencies or anything like that with him. He is a very smart kid, and he's been in a regular school. We have graduated from speech therapy, which is
That
amazing.
is amazing.
Um,
Congrats.
yeah, thank you. He is incredible. Like, even without like missing teeth, he has found a way to make the sounds and everything. And they told me, they said that this is the absolute best outcome we could have had for his situation. So
Oh,
they were like, I mean, we have the option to go back if need to, as we adjust,
yeah. Hmm.
things. But yeah, so we've graduated from that. So yay. Um,
Yay.
and right now he just has a 504. It's just like a medical, help. But he goes through school. He plays sports. He really likes soccer. Yeah,
That's
he's a
awesome.
normal kid, which is
Yeah.
what we have really strived for him,
Yeah.
just normalcy as much
Yeah.
as we can offer him.
Yeah. For sure.
Mhm.
For sure. I love that because, I mean, as long as he can do it, he's got to go through and figure it
Right,
out. And you guys are a
right.
good support system for him. And
Exactly. And I feel
yeah.
like the more normal we treat him, the better. I mean, like he gets
Yeah.
in
Oh,
trouble, he eats his vegetables. He's just like every other kid, you know? Yeah,
Yeah.
he's got to do it. So he's got to clean that room. No
Yeah.
special treatment
Yeah.
here.
Yeah, I wanted to just kind of ping back to a little bit of like when you guys were doing your research, like you said, your husband's a doctor. I'm sure
Mhm.
that I would assume that helps like navigating some of these spaces, just like obviously the knowledge and stuff that he's learned along the way. Um,
Yeah.
if you had to give any advice to like newer parents going through this, or if they just got that diagnosis, are there certain outlets, I guess you would recommend like looking into? Like, I'm just thinking if they don't have, like the medical background.
Yeah. Well, I mean, don't I'd say don't be afraid to ask for help.
Yeah.
Because I know some people might be, nervous about doing it or whatever, but ask the PCPs for help. Ask,
Mhm.
because they might know of organizations or
Yeah.
something that can assist, which is what happened with us actually fairly recently. Um, the I took Ronan in for his regular checkup or whatever, and um, when I mentioned the sweat glands kind
Yeah.
of thing, and I said that I'm nervous now that he's going to be getting into sports and school in the summertime. I was just I'm a little nervous about him being able to handle the heat because we've had
Mhm.
some really actually hot and humid summers lately. So and she was like, well, that we've got this program. It's sort of like a pro bono group that looks for like families that need help, if they have like children that need certain things. And she was like, I was looking into getting a cooling vest for him
Mhm.
to wear,
Yeah.
but they're very expensive, very expensive. And she was like, you know what? Let me get you in contact with this group. And I started corresponding with them, and they ended up buying him um,
Wow.
two cooling vests with extra ice packs. Like they went
Yeah.
above and
That's
beyond.
amazing. Yeah.
And it was only because like I mentioned and I talked about it. and
Hmm.
and there are programs, and this is one thing that doctors or at least the support from hospitals should be telling people,
Hmm.
that there are programs in people's areas that are, for now,
Yeah.
um you know set up to help families with high medical needs and stuff.
Hmm.
Like when Ronan was little, because he had a cleft lip and palate, he couldn't breastfeed. He had
Hmm.
no roof of the mouth. It was
Yeah.
like,
Yeah.
cathedral ceilings up there,
Yeah.
And so we had to have a special needs feeder. I think it was called the Haberman bottle. I don't know if you're familiar with it, but um, the nipple part has a reservoir, so you actually squeeze the milk into the reservoir, or yes, into the reservoir, and then squeeze it into his mouth because he
Hmm.
can't suck. He
Do
doesn't
it.
have
Yeah.
the sucking action. And those bottles, when Ronan was little, I don't know how much they are now, were $40 a piece.
Wow.
Can you imagine? Like, if think about a normal person,
Yeah.
and like they got 8 bottles on their
Yeah.
counter that they're washing.
Yeah. Yeah.
One bottle is $40.
Yeah.
And so they connected us with this organization. It was like a community partners kind of situation. And that organization provided us with a bunch of those bottles for us, so we didn't have to pay for them.
That's amazing.
And she was like, let me know if something happens and you need another one. I will overnight it to you. And that's exactly what she did. She overnighted a bottle to us.
I love that.
And I mean, so these programs are there,
Yeah.
and hopefully the hospitals are dispersing this information.
Sure.
Because that's what happened with us. I wouldn't have known.
Yeah. Right.
I had no idea, that I had access to that kind of resource. So I'm hoping, maybe just at least say like, hey, is there any kind of group or something like that, because I think people don't know to ask. That's the problem. That people don't know to ask. So if they're not giving this information at the time,
and that's why these conversations, and that's why the conversations like these are so important, because also when you're in that immediate situation, like, or however you handle stress, and you go in and you're asking the questions you think that you're supposed to ask, maybe you also forget some of them anyway, or you don't know what questions to ask because this is the first time you're navigating this space. You're overwhelmed and sad and stressed out and all the things, and you can take the information that's given to you, but sometimes it also lacks like, oh, and just so you know, there are all these other things that are here to support you. So I love that you mentioned that, because hopefully someone that is in need will hear it and like look into it and know to ask. And I don't think there's any bad question to ask, right? That's why we try to like be big advocates to all of our listeners. And I mean, that's what you don't know, what you don't know. And it's okay to ask a question so you know that you're making a well-informed decision.
Exactly. I mean, I feel like if you go into a doctor's office or whatever situation with a list, because I mean, you're bombarded with so much information, only certain things are going to stick. So, and if you've got all this information in your head, just rolling around in there, like it's good to come in, get organized. You got to get organized.
Yeah, for sure. And I think also encouraging, like, bring someone else with you or record the conversation, because what I've heard time and time again, like talking to other individuals, is like sometimes too, like, I mean, you have this in your everyday life, like you'll have a conversation and you'll hear something different than someone else does with you. So it's okay to like take your phone and record it. So that way when you can go back and reflect, we know what was really said. And that way you can, figure out what is the next step.
Oh, absolutely. I mean, I've done that with my husband a few times, just because sometimes the medical jargon, it's not really in layman's terms. No. And if it's a really long name, like Ectrodactyly Ectodermal Dysplasia Cleft, it's not going to get in, so sometimes it's, if there's something I don't understand, I could, I'd be like, what does this mean? Kind of thing. And he can kind of help me
for sure
explain it to me and stuff. So definitely having that second person, especially with mom brain, you don't know what's going on in there.
No, especially early on postpartum. It's a mush. Unfortunately.
I have had, I think, perpetual scrambled eggs up there, honestly. So
I feel you on that. You're not alone. Did you guys have to travel at all for any of these procedures, or were you like always having the procedures where you live? Because you were in Maine, now you're in New Hampshire. So, I mean, tell us a little bit.
Yeah, it's been quite a journey for us. Like we were up in Maine. Clifton is actually where we were when we got the diagnosis for him, and we had to go to Boston Children's Hospital. There were doctors there in Portland that could have helped, but it's a matter of doing maybe like 10 a year versus 100 a year.
Yes.
You know what I mean? And obviously Boston Children's Hospital is the best children's hospital in the country. And just that whole sort of like, area medically, it's just the best. It was the best resource. So we were driving 5 hours for appointments.
Wow.
Like, one way. And my husband was taking, this is for like appointments, pre-op, post-op, and it got to the point where my husband was using all of his vacation time
Mm-hmm.
for these appointments, and we're
Yeah.
like, we need to move closer.
Yeah.
So what we ended up doing was moving down to the seacoast of New Hampshire, in the Oyster River, like in Madbury, New Hampshire. So it was an hour and 20 versus 5 hours.
Yeah.
So yeah, I mean, that's the majority of, we do see a nephrologist at Dartmouth, but all of our care is at Boston Children's, because it's been kind of amazing, because we're able to cluster our appointments sometimes. So
Great.
he'll see the plastic surgeon at this time, and all in one day. So
Yeah.
that way we don't have to, because even an hour and 20, that takes time.
So commitment.
Especially going into Boston, you got to time that. Otherwise, it's a 3-hour trip.
I believe it.
So, and yeah, it's actually about the same from where we are now that we moved up to Plymouth in the White Mountains. So, yeah, I mean, and I've had to go every month for the past like 5 months. So it's usually me that does it. And, we just make a day of it, because it ends up being a day.
For sure. Yeah, I can imagine. And thank goodness you're able to do it. I'm sure he is very appreciative that he gets to have his mom with him every time.
Yeah, definitely. I mean,
Nice.
it's been very complicated. There have been times where, I'm staying in the hospital with him overnight, and my husband's sleeping in the car in the garage.
Yeah. Oh my goodness.
That kind of thing, just because, and like, you can't, it's hard for some people to get a hotel every time. Oh, here's a tip for some people. We found out that if you're going for a procedure or whatever at Boston or at a children's hospital, if you tell that to a lot of like the local hotels, sometimes they give you a discount.
Oh, wow. That's amazing.
Yeah. We found that out. Like, if you're visiting there, they'll give you a discount. So that's a nifty tip.
Yeah, I know there's a lot of stuff out there. I was recently just speaking with a mom locally, and I grabbed coffee with her, and she's in like the Tampa Bay area, and they travel up to, I think it's Ohio, for her son's treatment. And she was telling me that like Delta, I guess people will donate their miles to Delta, and Delta will like, there's some sort of program that then, so they use Delta to fly every time, and they don't have to pay anything because it's for cases
amazing.
like this. And I'm like, oh my gosh, like I had no idea. I had no idea that this is like even a thing. So there is a lot of support out there. And just like you said, ask the questions. Like, that never crossed my mind for a second. I was like, so like, just keep my head down. Let's get to Texas. Let's do these surgeries. Let's get back. Like, how are we going to manage this? I never thought about asking for help. Not even once. I was just like, this is what we have to do. So we're going to do it. And I hope to be able to allow for some other guests to come on and then talk more about that, because I think that can be super helpful for a lot of people.
Definitely.
So
I think we become a lot more assertive.
You
have to advocate for your kids. So you start asking these questions you wouldn't think. I just did that recently. Because staying at a hotel down in Boston, because there was an ice storm coming, and I was like, I cannot miss this appointment. So I stayed overnight, and I was like, hey, you got a discount? And they gave it to me.
Never hurts to ask.
That's right.
Does Ronan have like any big goals and dreams here? Does he talk about any of that stuff?
He doesn't. He's at the stage where everything his answer is, I don't know. I don't know. So I mean, he's in a, this is incredible. Despite missing fingers on his right hand, and he's also ambidextrous, by the way, because he had to learn how to use his left when he was in a cast on his right for both hand and foot, because we had that done at the same time. But he's an amazing artist.
Love it.
Incredible.
That's great.
Yeah. He's an incredible. So I'm hoping he continues that, because he's got some serious talent there. He's also talked about being an astronaut too. So, the typical kids.
You never know. Yeah. Typical preteen stuff for sure.
Exactly.
I
Yeah.
think every little boy wants to be an astronaut at some point in their life.
Yeah. Yeah. Yeah.
How
Absolutely.
how has his older brother handled all of this with so much attention being on the younger brother and all of that?
Yeah. Yeah. Well, we, this was part of what made us, helped us cope with all of this, is that we became such a strong family unit, because we didn't have family nearby. We
Mhm.
did all this all on our own for the
Wow.
most part. Like, there were times when my mom came up to help, for like a
Mhm.
surgery, or my husband's cousin came to help us and watched my older son, you know. Um, so we became really strong as a family unit,
Yeah.
and we brought Denny, my oldest son's name's Denny. We brought him along
Yep.
the entire time,
Yeah.
so that way he could learn about it and
Mhm.
educate and be an advocate for his little brother.
Oh, yeah.
Because I told him, I was like, there may be times where where Ronan's going to get bullied,
Mhm.
and you need to be in his corner,
Yeah.
like, and you need to help educate people. So, um he's been along he's been with us this whole time, through this whole journey, and has seen and helped with Ronan and myself, um and I asked him actually that question not too long ago, maybe like 2 months ago. I asked him, I was like, how are you okay with, or how do you feel with us maybe giving Ronan a lot of this extra attention? I was like, does it bother you? And he said no. He said it doesn't bother him. He doesn't feel left out, because I really try my best, because I don't want him to feel that way. I don't want
Right.
him to, because I told him, I was like, this, I mean, whether he likes it or not, I make sure I get one-on-one time with him, and my husband does too,
Mhm.
because we do have to
Mhm.
put a lot of attention on Ronan,
Yeah.
you know,
Yeah.
and I love on both of them so much. I want to make sure that they both know how much they are valued and loved, and that they feel safe, and yeah, I think he's doing okay with it,
Yeah.
like, he's protective of him, and I
Mhm.
think that shows how, like I said, they have such a good relationship,
I love
you
that.
know, they're
Mhm.
buds.
Yeah.
And so it makes me happy, because I don't want him to feel left out, or, you know, have any kind of negative feelings about it. Because we included him in this process, he understands the necessity.
Yeah.
You know what I mean?
Yeah. And
Yeah,
the communication I feel like is really key too. So that's beautiful.
absolutely.
You guys have a good thing going on.
I hope so.
Yeah. Yeah. We never really know until they get older, right? But we're trying our best. You're
We'll
doing
find
amazing.
out how screwed up he is.
Yeah. I know. So one of my like one of the people I know that's a therapist was telling me like, let's just hope that we send our children with like a carry-on bag versus checked luggage. And I was like,
Yeah,
I like that perspective.
exactly.
Yeah.
Exactly.
Yes.
Yep.
Good way to think
Mm,
about it. Well, is
yeah.
there any like last words of like support or encouragement you would like to put out there for families going through this type of diagnosis as well?
I mean, just find a community.
Yeah, I
I
love
mean,
that.
even within your own community, it doesn't necessarily have to be something formal, you
Hmm.
know.
Yeah,
Um, there are people out there that want to help.
yeah,
I
yeah.
mean, and I think this is one of the things that I think is so important. If you educate other people, I mean, I have had to do that a lot with kids, coming up, because he looks different.
Hmm.
I mean, he's had a lot of work done, and in Boston has done amazing things, but he's still, there's things about him that are different, and there's questions that are asked,
Hmm.
by kids mostly, but adults too,
Sure.
and education. educating them is so important, because then now they're invested.
Yeah.
You know what I mean?
Yeah.
And so, I mean, I didn't even ask for this, but Ronan was very sick at one point. I mean, he had infections from here down to his lungs, like pneumonia, like
Yeah.
bronchitis, like it was all, because it's all kind of connected. It's all open.
Yeah. Yeah.
It's very easy for him to get infections in other areas. And I think he's might be immunocompromised too, which is, it's just my guess. But
Yeah.
anyway, he was out of school for a long time. He's just sick,
Yeah.
for so sick. And another parent just showed up with a bunch of groceries on my doorstep.
Yeah.
I didn't
It's
ask
impactful.
for it. I didn't, but she knew his situation. She knew how much we were going through and how much school he was missing. And she just wanted to give me a break.
Yeah.
In this little way. So, I mean, find your community, educate people about, your situation.
Yeah.
And the help is there.
Yeah.
It is. People do. There's so much bad in the world right now, but there's so much good.
There is. Yeah,
also.
for sure. And I love that you said that, because it's so true. There are really, really good people out there, and they want to help, and they don't know how to if you don't bring them into your world a little bit.
Exactly. That was probably the biggest thing for me, is that it is just education for people, bringing them into our world, letting them see things from our perspective, and that the help is there.
Yeah.
Your support is there. Even if your own family isn't in the vicinity, you've got support.
Yeah. And it doesn't take away from your strength at all. It just allows for you to be human and receive help when you absolutely need it.
Yes. Yes. And sometimes, even if it's a date night, you can just, get a little bit of respite,
Yeah.
It's just step away for a second,
Yeah. Yeah. Your ability to take care of yourself is also extremely important, to be able to show up and be the caregiver that you need to be.
Absolutely.
Yeah.
Absolutely. I'll find all my marbles one of these days.
When you do, you let me know how you did it. Okay.
Sounds good. Sounds good.
We'll figure out that. We'll sell that somewhere.
Yeah. Sounds good.
Well, thank you so much. I know this will be super helpful and impactful for other families, so we greatly appreciate it, and hope that you don't get too snowed in there.
Oh yeah, no, we're good. We're adapted by now, I hope.
I'm sure.
Thank you so much for giving me this opportunity to just tell my story and educate people about EEC syndrome.
Yeah.
That's awesome. Thank you guys so much. I appreciate it.
Our pleasure.
Yeah, absolutely.
You'll definitely bring some community to other families going through it that don't have one yet. So thank you for mentioning all the resources that you did.
Yeah, no, thank you. All right. Yeah, it's nice meeting you guys.
You too.
Good to meet you.
Yeah, we'll chat later. If this episode steadied something inside of you, share it with someone who needs to feel less alone. And if you are walking a rare diagnosis journey and feel called to share your story, we would be honored to hold that space with you. If this episode resonated with you, we'd love for you to take one simple step. Share it with a friend, another parent, or a caregiver who might need to know they are not alone in this journey. Make sure you are subscribed so you will never miss an episode. We release new stories every Monday. And if you're looking for more connection, resources, or ways to share your own story, come join us on Instagram at bornforthisstories, or visit our website at bornforthisstories.com. Remember, whatever part of the journey you are in, the waiting room, the recovery, or the in-between, you do not have to carry it alone. We see you, we stand with you, and never forget, you were born for this.